Show sponsored by. Well, today Dr. Akos is I'm hosting. I will be hosting Dr. Akos, who is going to talk to us about headaches. And it looks like she has a headache herself. So without further ado, just want to welcome everyone, each and everyone on our shows. Want to welcome you here on Zoom with us, you and on YouTube and on Facebook as well. And without further ado, Dr. Akos, go on.
Hello, good evening, everybody. Yeah, sorry if I'm a bit slow today. I actually do have a headache, and I'm wondering if it's because I decided to talk about headaches. But I'm gonna get straight into it. So actually, there's this thing called forehead that I tend to use. It's actually really quite good. It's like a roll-on that you roll on your forehead. It's really minty, and it makes my eye hurt. But I think it's quite nice. Anyway, digressing. So today I'm going to talk about headaches. Headaches are incredibly common. A lot of people get headaches, and there are different types of headaches, and I'm going to go through today. So again, the slides that I tend to use, if the host can allow me to share my slides, please. So the slideshow that I'm using today is basically one that I made for teaching medical students. So it has a lot of information on it. It has like a lot of some things that might not be relevant for the remit of this talk. So, but I'll skip through. So if you see, I'm just gonna try and share my screen. So let me know when you can see my screen. Okay. Can you see it?
Yes, we can now.
Okay. Fine, I'm going to go all the way to the top. Right, so today I'm talking about headaches. Right, so I don't really need to explain what a headache is, because I think we all know what a headache is. When your head hurts, it can hurt in different places. So I'm going to show a slide which will show you the different regions of your head where you can get a headache, and some of the regions will tell us what kind of headache you get. So you have, for anybody who knows, there are things like we've got migraines, we've got tension headaches, and then we've got more serious things like a bleed in the brain or like a brain tumor. So headaches can be from anything from being very, very these red flags. I will advise you to go and see to seek medical attention, basically. The rest of the is really for medical students. So history taken, physical exam, differential investigation, that's all are taught to do, or what we're, but again, I'll go through it so that it kind of helps you understand what we do when you come to see us with a headache, the kind of things we do and how we differentiate. So you might say, every time I have a headache, I go to the doctor sends me home, is because you're not meeting some of these criteria. So I'm just going to go through it for you to understand that as well. Okay. So, right, types of common headaches are cluster headaches. Wait, hold on. No, yeah, I thought I skipped a slide actually. Yeah. So there are two main types of headaches. They're primary headaches, and then there's secondary headaches. Primary headaches are basically headaches that are just headaches and don't have any cause. And then secondary headaches are basically headaches that are caused by something else. So they're secondary to the cause of the headache. So for example, if you have a migraine is a primary headache because it's just a headache. There's no underlying cause. But if, let's say, Abna was to punch you in the eye right now and you ended up getting a headache, that would be a traumatic headache, because there's actually a cause and an effect. Something happened for you to then get the headache. So that's a secondary cause, and a secondary headache. And then there are other causes, which I'm going to come to, and then they're like the ones that within those other causes I've labeled the serious ones, which you need to look out for. And there's some 4 or 5 things that you need to look out for when I say a serious headache. So we'll talk about that in a minute. So primary headaches, the main ones are cluster headaches, tension headaches, and migraines. These headaches are really, really confused with each other. So a lot of the time, I always say migraines are overdiagnosed. And the reason I say migraines are overdiagnosed, I feel that anytime that somebody's got a primary headache and goes to see their doctor, the doctor will literally diagnose them with a migraine. So this slide is just to show these are the different types of headaches. Again, the different types of ways they'll present. So if you see where the orange highlight it is. So a cluster headache tends to be pain around your eyes. And it usually happens sort of at night. Why it happens, we don't know, but that's a cluster headache. This, out of all the primary headaches, the cluster headache is probably the most uncommon one. So you can get other headaches which can affect your eyes, but a lot of the time, cluster headaches, we don't see that very often. Tension headaches, like I would say, probably is the most common with outside of migraines, because again, but I said migraines are overdiagnosed. So a lot of the time, tension headaches and migraines, I think, are sort of diagnosed, are interdiagnosed within each other. Tension headaches, a lot of people will say feels like a tight band, and that's what I'm feeling right now. So it's a tight band around your head. So if you imagine wearing like a headband, especially for ladies, if you wear a headband around your head like this, and you feel like somebody pulling it back, and literally is a tension at your frontal headache on this place, and it sometimes can go to the back as well, but that's the type of headache. And then migraines are sort of half your face. They can be bilateral. I think Dr. Kujo mentioned last week, you can feel them on both sides, but a lot of the time it affects one side, it's really painful. And the migraines also come with other things as well. So sometimes it's triggered by coffee. Sometimes with ladies who menstruate, it's triggered by menstruation, triggered by drinking alcohol. So migraines tend to have triggers. And then you have some other signs with migraines, signs like light sensitivity. So if I had a migraine right now, there's no way I could do this talk right now, because I'd need to be in a very dark room under my covers, because migraine tends to, we call it photophobia. You're very light. You don't want the light at all when you're time. Again, it's not all the time, but all the time. So that's sort of your primary headaches. And then oh yeah, so this is just another slide that just shows, I think I've already talked about this. It shows you the difference between the three types of primary headaches. So the pain location, migraine is one or both sides. Tension headache is like a band around your head. The duration, migraine hours to days. Tension headache is also hours to days. So you can see where you can see where the two can sort of be interchanged with each other. Yeah, but I was quite right. Look at that. See, tension headache is most common, and then migraine affects 10% of the population. However, a lot of people who get tension headaches will end up saying they have a migraine, but it's really, really not that. Tension headaches are really, really the most common, and they tend to come from things like stress or overworking, not drinking enough water, that type of thing. So then I talk about the secondary headaches. So these headaches are headaches that have a cause. So for example, a sinus headache, you get it around your nose. So your sinuses, if you think about it, whenever you have a cold. So sometimes when you have a cold or you're feeling a bit snotty, some coryzal symptoms, you find that you have a headache. That's because you've got stuffiness in your nose and in your sinuses, and that can cause some pressure in your head. You tend to get this sort of headache behind your nose or like inside, and that's a sinus headache. Hormonal headache, we've talked about, that can actually be migraine as well. So hormones can cause you to have migraines, but also you can have a hormonal headache, which is basically a lot of hormones causing you to have headaches. High blood pressure, we talked about this before, that can cause your headaches. And trauma, so that when I talked about Abner punching you in the head, if Abner punched you and you were to get a headache, that would be a post-traumatic headache. Okay. Again, when I talked about the other types of headache, these are all secondary headaches. If you think about headaches caused by stress, but again, a stress headache could mimic a bit like a tension headache. So these are just examples. I'm not going to go into them, but sleeping is important. So not sleeping can cause you to have a headache. Again, it can cause you to have a tension-like headache, but then there's a sort of a secondary cause there. So if you're not sleeping and you're getting a headache, then obviously that's almost like a tension type headache. Visual strain, so people who read in a dark room. So if you're using a lot of computers and you're finding yourself straining your eyes to the computers, or if you're reading in the dark room, reading at night without the light on, that sort of thing can cause you a headache. And I talked about not drinking enough water as well, so dehydration. Now, this is 1, 2, 3, 4, 5 things that I call the serious headaches. So maybe a lot of you have actually heard of something called a subarachnoid hemorrhage. I think that's quite a common presentation, and you probably have heard of it. And meningitis, definitely you've definitely heard of, especially if you're Ghanaian, you've heard of what meningitis is. These other tumors is a cancer as well, so you've probably heard of that as well. But the other two, again, they're medical terms. You don't need to know that. As I said, this was a slide for medical students, but you just need to know that they're quite serious. So a GCA, or temporal arteritis, so it's not arthritis, which is a disease of the bone. It's arteritis, which is a disease the vasculature of your brain, your head. So if you look at the word, it's got artery in it. So it's basically the inflammation of your artery, and the temporal artery runs on your temporal bone just here. And if you have GCA, literally some of the signs that you get, if you press on this area here, you get a really bad headache. Sometimes combing the hair can cause you to get a headache, and it's really bad. And sometimes you can get this sort of pulsatile feeling, so you can actually feel the artery pulsing there. And this is a very serious type of condition. It can cause you to sort of lose your eye, and there's a lot of complications with this. So this is quite a serious headache that we take quite seriously. And then the last one, idiopathic intracranial hypertension, is basically, if you think idiopathic just means we don't know what causes it. Idiopathic is a word that says, it's a medical term that just tells us that we don't know what the cause is. It's idiopathic. We don't know it. Intracranial just means inside your head, and then hypertension, high blood pressure. So we don't know something inside your brain that's causing high pressure in your brain, and it's causing you to have a headache in your brain. So it's literally just it's a tension inside your brain that is causing you to have okay. So right, the red flags so these are the red flags for each of the things. So if you think we've got 5 red flags here, and we've got 5 conditions here, right? So something called a thunderclap headache. So it's funny because I had a patient just recently, and they were describing to me that they had like the worst headache they've ever felt in their life. And I said to them, can you describe the headache to me? And they just said it was like the worst headache. It was like an electric shock has gone through my body. And these are the kind of descriptors we're usually looking for. A subarachnoid hemorrhage is very, very classical of the symptoms. That is a thunderclap headache. Essentially, if you're sitting there right now and then you just get like this headache, like something has hit you, like and it's very sharp. So that is just is a type of headache that is like it's a popping of the blood vessel in your brain. So that's why it's called a hemorrhage. So a hemorrhage is a bleeding inside the brain, and a subarachnoid hemorrhage is basically a bleeding, and it doesn't have any cause. It's not like a traumatic cause or anything. It just sometimes it just happens. So if you're just there and all of a sudden you feel like the worst, you literally feel like the world is crashing down on your head, and it all happens at once. That's the kind of headache that I'm talking about. If you ever experience those symptoms, do not wait. Do not even call your GP. Just go straight to A&E and say, or call ambulance and say, I feel like I've got a thunderclap headache. That is a keyword that will just blue light you straight in. For meningitis, the things that we look out for is neck stiffness, fever, and photophobia. What I mean by photophobia is, so photo is a word for light. Phobia means scared of light. So if you've got neck stiffness, you have a fever, and you cannot tolerate light whatsoever, these are the 3 classical signs of meningitis. You need to go straight to the emergency department, bypass your GP, straight to medical emergency department. 3 signs to look out for. This is classical signs of meningitis. This one is basically a persistent headache which worsens over time with neuro symptoms. Again, because this is for medical students, like I can't get really into this because neuro symptoms is not something I can explain to you right now. So if you have the key terms I can say to you, if you have a persistent headache, so a headache that comes on all the time and it worsens over time. So let's say your headache started last week, but as the week progresses, the headache is still coming, but the headache is getting worse. So maybe last week the pain was 2 out of 10, and then this week the pain is 3 out of 10. Next week is 4 out of 10. Then basically it's getting worse and worse and worse. It's not getting any better. Then we're usually worried about things like a brain tumor, because it just means that the brain tumor is probably getting larger and is pressing on structures, which is making the headache worse. And oftentimes this headache does not improve even with medication. So even with paracetamol, ibuprofen, it doesn't get better. Neuro symptoms is a lot of things, but the things to look out for is but in particular, if you start to get changes in your eyesight, if you start to get changes in weakness in your hands, weakness in your legs, sort of tingling in your fingers, numbness and tingling, these are some signs of neuro symptoms. It doesn't mean that you've got a brain tumor. There's so many other conditions that can cause these symptoms, but it's a collection of things that you go to your doctor, you say, I have a headache, I have this, I have this, I have this. They'll put it together and they say, it sounds like you might have this. We'll do a scan just to rule it out. Okay. This is what I talked about, scalp tendon for the arthritis. So scalp tenderness, jaw claudication. So what all that means is that your jaw feels a bit stiff and feels a bit like stucky, and then you get visual changes with this as well. So if you've got any scalp tenderness here, a bit of a clicky jaw, and then you've got some visual changes, then you're worried about GCA or temporal arteritis. And then this papilloedema just means fluid behind your eyes. But if you look at that, it says papilloedema on examination. OE means on examination. So with that, with the raised intracranial pressure, there aren't really any symptoms for that, the raised pressure in your head. The only symptoms that I can say is if you have a headache first thing in the morning, the reason that happens is usually if you're lying down, the pressure in your head is low. So it doesn't usually cause any symptoms. But as soon as you stand up, you get this really bad headache. And that's usually a first and telling sign that you've got a raised pressure in your head. So if you've got morning headache, and I'm not talking about just one-off. If you have a one-off morning headache, I wouldn't rush to my GP to say I've got a raised pressure. But if this is an ongoing thing, every morning, as soon as you wake up, the first thing you get is a headache, which is so crippling that you probably have to sit down or lie back down. It probably means that you've got raised intracranial pressure, you've got fluid in your brain, which is causing so that, and on examination we will see something called papilloedema, and we can tell that you've got this condition. So I know I've spent a lot of time on this slide, but I just think it's important because these are the red flag symptoms that you need to go and see a doctor about in order to for us to sort of, for you not to get complications from these serious conditions. History taken, you guys don't need to know this. This is from a doctor's point of view. When you come, these are the things that we usually ask. This is called Socrates. So if you look at it, a lot of doctors will go through this with you. It's site Socrates, so SOCRATES. So site onset. Site just means where is the pain. Onset means when did it start. Character means is it dull? Is it sharp? Is it achy? Radiation, that means does it move anywhere? Associated symptoms, I talked about. Is your eyesight affected? Are you getting nausea and vomiting from it? Are you getting neck stiffness or photophobia? Time just means how long does it last? So is it every day? Is it just 1 hour a day? Is it in the morning? Exacerbating or relieving factors. So like I said, does it get better when you lie down? That's the relieving factors. Does it get worse when you stand up? That's exacerbating factors. Severity, oftentimes doctors will always ask you, anytime you talk about pain, a doctor will ask you out of 10, with 10 being the worst and 0 being no pain, where do you see the pain at? If you're telling me your headache is 10 out of 10 all the time, even when you've taken paracetamol, it doesn't get better throughout the day and is actually getting worse, that is a red flag symptom. Okay, so these are the things that we look out for. Physical examination, you guys don't need to know this. This is totally medical. Differentials, again, you don't need to know this. So when we talk about differentials, a doctor, whenever you go to see a doctor, you tell us one thing and we have at least 5 things in our head that we think it might be. And this is why I always say when people ask me questions on this platform and I say, I can't tell you, because if you tell me you have a headache, I've got... on the word headache, I've got like 50 things it could be. Then I'll ask you one thing and then you say to me, maybe I've got my eye hurts as well. And okay, if your eye hurts, I've got 20 things it could be. Then I'll ask you, okay, are you vomiting with it? If you say you're vomiting, I've got 5 things it could be. So basically, that's why we do history taking. Doctors are like detectives, right? And a lot of people say we ask a lot of questions, but that's because we have to find, by us asking those questions, the answers that you give us, it narrows it down to what it can be. And then right at the end, we've got at least 5 things it could be, and that's what we call differentials. So within the 5 things, if you come to me and say you have a headache and I'm thinking 5 things, I have to rule out the most serious thing. So if I think that within those 5 things, there's a red flag symptom in there, I'm going to get your head scanned because I need to make sure that it's not that thing. But if within those 5 things, it's all like tension, headache, migraine, or it's like something that I'm not worried about, I'm going to say to you, take paracetamol, come back to me if it gets worse. Okay? This is also another thing. That's why I always say to people, when you go to see your doctors, do not exaggerate your symptoms because you just prolong us finding out what's happened. I'll give you an example. A lot of the time people feel like, oh, I have to tell my doctor this, that. But like I said, we are detectives. We don't know everything. So when you tell us something, or if you're lying about something, sometimes we can tell. Because if you come to me and you say, oh, doctor, I've got heart pain. And I say, okay, do you have any leg pain as well? So, oh, yeah. When my heart hurts, my leg hurts as well. And immediately I know that you're making stuff up because I'm like, okay, either you're making stuff up or the two unrelated symptoms, like it doesn't add up at all, because we have pattern recognition that we use. The second thing is, if you tell me, for example, you have a headache, and then if I say, okay, do you get vomiting? And you say, yes, I get vomiting. And I say, okay, do you have neck stiffness? Yes, I get neck stiffness. Okay. Have you had any visual changes? Yes, I have visual changes. Okay. Do you have any tenderness on you? Yes, I have to. So if you're just making it harder, because you've just told me you have all the red flag symptoms. So now if I'm going to investigate, I literally don't have a point where I'm investigating. This can actually delay your diagnosis, because now instead of looking for what I should be focusing on, I'm looking at everything else. And maybe by the time that I realize it's not this, actually is this, it might be too late, because you've actually exaggerated your symptoms. So as much as I say, if it's all happening, definitely do tell us. But if it's not all happening, you feel like, oh, I'm just going to add a bit more so they know that this is serious. Actually, sometimes the less symptoms you have, the better. But it's about the severity of the symptoms. It's not about how many symptoms you have. It's about the red flag symptoms. So somebody can come to me and have all the 10 symptoms of a primary headache, and I'm not going to do anything about it because it's a primary headache. But somebody can come to me and just tell me they have one sign. If you come to me and say, I have a thunderclap headache, that's all I need to hear. You're getting a CT scan. You don't even need to tell me anything else. So this is what I mean. Just tell the truth when you go to see your doctor, because it makes diagnosis so much easier. So yeah, common investigations for headaches is CT scans, MRI scans. We do blood tests, something called ESR, but you don't need to know that. And a lumbar puncture. So a lumbar puncture is when we take a bit of spinal fluid from your back. If you're a woman and you've ever given birth and you've had an epidural, it's very similar to that, but we just put a needle in your spine and we draw some fluid out. That's because we get the cerebrospinal fluid, which is basically the fluid in your brain. This is a diagnostic test for meningitis. So by testing the fluid in your brain, we're able to test whether you've got some infection in there, and we're able to tell that actually you've got meningitis or you haven't. So it's a very typical test for meningitis. So if your doctor is worried about meningitis, they will order lumbar puncture. Otherwise, it's usually not used for anything else. Yeah, and then there's different management. Again, you guys don't need to know this. This is more from a doctor point of view, but I've just broken it down into like 4 different types. So if it's like a primary headache, like a migraine or like a tension headache, we'd usually just reassure you and educate you, telling you, okay, maybe drink more, sleep more, avoid your migraine triggers, that sort of thing. If it's a lifestyle thing, like drinking alcohol, drinking a lot of coffee, we might just tell you lifestyle management. Some migraines do require medication, so you can have something like triptans, or you can have beta blockers, that sort of thing. And if it's any of the red flag symptoms I talked about, then you're getting a referral into secondary care. So if you go to your GP, you've got thunderclap headache, you're going straight to secondary care. If you've got gastric cell arthritis, if you've got brain tumor, you're going straight to secondary care. So that's the only time that we would refer you for a headache. Yeah. So as I said, this is more like top for medical students and GPs. So in the GP setting, usually headaches are quite normal. A lot of the population will have a headache. I've got a headache right now. As I say, headache is very, very common. You just need to know the red flag symptoms, again, from sort of a patient point of view. Just knowing when you should be worried about a headache and when you shouldn't be worried about a headache is important. And again, when you go to see your doctor, please do tell the truth, because if you keep added on symptoms and saying that unless it's true, don't get me wrong, if you do have all the symptoms together, please do tell your doctor, because then they can investigate for everything. But if you don't have those and you just think, oh, I'm just going to go and tell my doctor I've got a thunderclap headache because Dr. Kus said if I do that, then they'll see me quicker in A&E, then you're just really, you're not doing yourself any favors. And the next time that you do have a thunderclap headache and you go to your doctor and you say it, they're probably just going to think, actually, the last time he was here with thunderclap headache, it just ended up being migraine. So he probably doesn't even understand what thunderclap means. So please don't lie, because that can delay your treatment and that can cause more complications than it can cause benefits to you. Thank you. I think that's it. Yeah. Okay.
Thank you, Dr. Akos. That was a very extensive, what do you call everything? Should I say lecture? And that's the information.
Sorry.
And we already have hands up until Liz, please, let's calm down small for us. I think we will probably go for a quick break with adverts as per usual, and then we'll be back to take questions if that's okay with you.
Me did yan tachua, and maybe I'm discovered for you, Pakuma Busia for Ghana. No, me used to tap send. No fee mobile money transfer. Easy, convenient, fast, and sounds so free. Won't you share? Me discover ye map him. Tap send. Ain't also download the tap send app. No, ever mobile phone so free. Nefesi kakomu Busia for Ghana for na. Tap send. Papa no.
Well, welcome back. I wasn't expecting us to be back so soon, but this is lovely. Welcome back, everyone, to the talk show. And just to summarize, Dr. Ako just took us through a very extensive sort of like lecture, or should I say, teaching of headaches, types of headaches, and all the red flags and whatnot. So, as per usual, we are now open for questions, and we'll start with Auntie Liz, who had her hands up. So, if we can just go to Auntie Liz.
Thank you very much. Dr. Kush, we are in Ponyo, now full of knowledge, that's it. On behalf of Mrs. Naomi, was here brofono, and Tina Dabe catch you, when you kona, Becca say, Namuka Musisi, sooner, my name's what a baby, TNT, and idea, like Dr. Abna said, let's just see the minim said you'll be actually more trim, but yeah, now what it in them say I go to school. Bisa na Miniana Umi, I don't know. But thank you very much. Name the question is Dr. Kojo. We are missing one doctor. And now Dr. Kosi Tiani, then Dr. Kojo so for question CB.
Oh, I mean, we try to alternate between the two of them. So doctors, sometimes we is off off for if it's evening or nights or whatever shifts that doctors work, which is the reason why we have both of them around, so that at least on a good day, two of them would take the show, but on a bad day, at least we have one here. And other, visitors who get during the course of the year. So don't worry.
Okay, until long back now, have a and another one. One time okay. So question that yes, you was good. Thank you very much. Name my dear Bakun say, Uko who GPR. Don't exaggerate. But GP for a trip, yes, some bakunin sube, yen few, cough paracetamol, and teacher say, a trebia, no exaggerating itself, but which remuye and who's idea no, it's not what you think, nemum. Only to say your church, tiarium. A beer no afan says the first say, into my parana, some baby. And a teacher, ma'am, and walk out. Me koye kra wa nyamehwe on san kobio.
Yeah, true.
So I catch 22 situation.
Yeah, Matthias, I think it's important. And excuse me, sorry. So if somebody doesn't speak Tree and you want me to speak English, please let me know. It's because Auntie Liz has requested Tree in team. I'll try my best to say it. Yeah, into so what call GP sending a exaggeration is about adding symptoms. So sometimes when some power so called GP we say exaggerate crap to say be as we are say be we are 5 be I'll say I'm 10 fine. And I say be but me patch said don't add symptoms because be what nini and so no or feel so me kase me near me ya na me kase be me humuja or me bawa me humuja na so man for omo pile symptoms now then by the end of it you've confused the doctor because the doctor is like am I treating chest infection or am I treating like I don't know where I'm going with this because there's so much going on. But say be out tina ya, this be so yeah, me tia me ya, ebia say last 5 minutes. I shouldn't even be saying this on here, but for the purpose of your family, so it be 5 minutes cause you be a me tia me 10 minutes. Okay, babies are fine. You're not actually taking away from the symptoms. Maybe you're just exaggerating the symptoms a little bit. So you can get seen quicker because I know people do it. But say be a say be a untension cross you be a meeting me so much say me collapse like then that just adds, that's new symptoms, that's just adding new. So that's what I mean by let us not exaggerate the symptoms. No, like don't add new things to it.
Yo Matthias here. Wokofa bibi foforo kan kwa hwe prescribe aduro bi kura won hia ma wa ma no so abre wasem.
That's the thing.
I get it. Thank you very much.
Because sometimes some people have come to me saying that they have a headache, and then they say, so, they have eye pain, and then they have the headache. So because of the eye pain that they said, no, then suddenly I say, okay, then go to your optician, go and check your eyes first. If your optician say your eyes is clear, then come back. But if you come on for eye pain and come make us say, oh, okay, utia for more than 6 weeks now. Okay, let me go take you straight and do a CT scan. But as soon as you tell me your eyes is hurting, I'm thinking, okay, is there an eye problem? Go and see your optician first. So say, I'm pass definitely that's the right thing to do, and that's what our guidelines tell us. But so and I'll also be able to be counts and our doctor and boom say serious. You just you've just derailed the course. So I tell you to know. Yeah, that's just a bit on the doctor's side.
Thank you very much.
No problem.
Okay, yeah, thank you, Auntie Liz. And just to the point about Auntie Liz, Auntie Naomi, we apologize in advance. We try to accommodate the fact that not everyone speaks Twi. Even among the Ghanaians, not everyone speaks or understands Twi. But Sanya, Dr. Kosi, we can definitely speak Twi on demand. And we will try and go very slow with the English. Sanya, move it what we're saying, and then move the Dr. Kosi di Janikaka with the English.
I thought so. I thought I was speaking fast, but the reason I was speaking fast is because I had so much to cover that I didn't want it to be just me talk, because I'm mindful that we finish at 9, and I didn't want to not have any time for questions. So I apologize if I was too quick. Please do ask questions if you didn't understand anything. I'm happy to go slower and talk through things a bit more slower. So I apologize for that.
And we'll switch between Twi and English. We'll try Twi na papa, but we are trying here and then for understanding. Just before I come to you, Felicia, Nancy has had a submission in there, so I'll read through this. 2 weeks today, I woke up with a headache, and shortly after, I started throwing up. I ended up in the hospital because I couldn't keep anything inside me. When I managed to see a doctor, I was told it was a virus. I was discharged the following day, but I noticed that I had no appetite for almost weeks. Is there anything I should worry about?
Question. Okay. Let's break the symptoms down, right? So this happened 2 weeks ago. Ideally, what I would like to know is, are you still having headaches right now? And are you still vomiting? Because according to this, you said you ended up in hospital, but they checked you in hospital. When you're in hospital, I'm sure they would have done blood tests and swabs and things. So maybe they think you have a flu or something, which we know, again, I said the infection can cause headaches, right? Even the flu virus can cause headaches. So then you say you were discharged, and you notice you had no appetite for weeks. So I guess my 3 questions is, are you still having headaches? Are you still vomiting? And are you still having no appetite? So come back to me with the answers for that, and then we'll take it from there.
Okay, thank you, Dr. Nancy. We hope to hear from you soon. Until then, let's move on to the next person, which is Felicia.
Good evening. Afishapa.
Afishapo, welcome back.
Yeah. Thank you, Dr. Akos. It's good to hear from you. But I've got 2 questions. No, I've got 1 question and something to add to you. Please, when you are tackling things like headaches in your man. People trust over to me cry to 2 weeks to cry and kayebepe than you rushing through it, please, because it's very, very important when it comes to headaches and stomach pains in India and many man me that's my about it. Any problem so and then the name we drew. Yeah, my question is I've been told and I've tried it. Yes, so we are now the Coca-Cola. Echo chef freezer mu na cold now no more headache. I haven't tried it before, but is it true?
From a medical point of view, I don't know. That's the honest truth. Me put in, I'm a feel so because if I the shit fridge now the two swab because I tend to do that when I've got a headache. I sometimes put my head in the fridge or I take something very cold and sort of rub it on my head. That tends to work for me, but to drink it, I don't know.
Yeah, okay, because I've been told by quite a few people who they were talking about Coca-Cola and. I remembered when I was having my chemo, and I had a lot of diarrhea, and they called me from the hospital because they didn't want to. I didn't want to go in, and I was told take Coca-Cola. So anytime I have a diarrhea, I take Coca-Cola and it stops.
Diarrhea, yes. Headache, don't know. So diarrhea works very well for diarrhea, that I know. And even with that, sometimes I even say if you add salt to cook, and I think I've said it on this program before.
Yes.
So because what it acts as ORS. So for diarrhea, Coke definitely works. But for headache, I cannot see where medically I can't see the connection.
I know people have said it, but I haven't tried it. But can I just add to it? I used to suffer from headaches when I was in my my teenage to my mid-30s. I mean, headache, headache, and then when I was just studying, I noticed that listen, I have to change everything, lifestyle change. And since I did that, and then I had a lot of, I had constipation. It runs in the family. I had to really sit down and say to myself, what do I have to do? I had to just sit down and analyze all the things I was going through and what I could do to help myself. And I say it to the glory of God, although I've got a cold this year, I don't have a headache. And I can't remember the last time I had headache because I make sure, I don't get the constipation in the morning. When I wake up, I drink my warm water or I drink water, room temperature. And then I try to, the old, so minya constipation, I try not to, some young better, I can't say the tree, but me making sure I don't get constipation. I eat my fiber, my fruits, and since I had that, and I can for over 20 years, and I can tell you headaches in our core. That's how I did to just sort out my headache. I hope it will help someone.
Yeah. I mean, I think that's just good advice as well. And I always say that lifestyle changes are very important. And I think I mentioned that even here. So sometimes knowing the triggers of your headaches. So for example, I know that my headaches are, if I'm really hungry, I get headaches. If I'm dehydrated, I get headaches. If I don't sleep well, or I watch a lot of TV, I get headaches. So knowing your triggers is important because when I have a headache, sometimes I'm able to sit back and say, what have I done today that's caused the headache? And, I used to get them a lot when I used to write exams. So I used to get a lot of tension headaches, and that would be coming from stress. I know some of these factors we cannot take away. So if you need to write exam, or if you have a particularly stressful job, sometimes you can't take those factors away. But then there are things you can do if you know that you're going to do some stressful work, maybe just prepping yourself, having meditation before, making sure you're having regular breaks, things like that, that can help you sort of help with your headache. So it's very important. And for anybody who's had a headache, I mentioned this last week, I'll mention this again, headache diaries, very important. Very important for you to find out your symptoms. So for example, if like me, if you have a headache right now, you'd write down, okay, I have a headache, write down the time it starts, write down the time it ends, write down whatever you've done between those times, write down what you were doing before that. So what have I done today for me to cause this headache? I've been at work, I've not had any water to drink, I've not had any food to eat because I was fasting, things like that. So then you actually, if you keep a headache diary for about a week, or even not a week, if every time you get a headache, if you write it down, you have a headache diary, you'll be able to identify triggers within your headache. There was a lady who came here last week who said she gets a headache every time that she gets her menstruation. So immediately we know that she's having hormonal headaches because it's triggered by her hormones. So if you go to your doctor, if I'm a doctor and you come to me and you say, doctor, this is my headache diary. Every Tuesday, this time I get headache. You've done half of the work. So for me, I cannot send you back home and say, okay, go and write a headache diary or go and try paracetamol, because the diary is telling me you've done it all. You've told me, doctor, you're saying I should try paracetamol, but as you can see from my headache diary, 2 weeks ago when I got headache, I tried paracetamol. It didn't help. You've already given me all of that. The next thing I have to do is give you a scan, because there's nothing else I can say, go back and do that. So sometimes keeping a diary is actually more helpful. And when you go to your GP cannot tell you, oh, go and take paracetamol, because you say, GP, I've already done that. It's not working. So give me something else,
Yeah, thank you, Felicia, for your submission and your question. Thank you, Dr. Kos, as always. Very good about the triggers, because right now I'm really cold, so I'm starting to get a headache. So cold is like one of my stressors, clearly. Again, just to let everybody know, we will be going through the questions. It will not be in order sometimes, because sometimes I might lift ones that relate to what we're talking about and whatnot, but it's not to say that I've forgotten you. So not to say I've bypassed your questions or anything. So I just wanted to sort of, as we're speaking about, as Felicia spoke about her contribution and way she was able to stop her headache, Kofi has also brought a contribution, which is drink at least 8 cups of water a day. Don't sip, drink. Try using the washroom at least twice a day. Reduce on your antibiotics. Sleep well. Avoid more screen time and more rest, which I think screen time is very important for us modern day generation, because yes, I sometimes using my phones are empty. So that's definitely that.
Dr. Abner, use the washroom twice a day. No, what does that mean? And I feel fizzy drinks and so my headache. And Auntie Felicia saying that Coke straight from the fridge, and I don't know. Anytime I take fizzy drink, I get headache. So I stay away from fizzy drinks.
I think it's important. The washroom twice a day. Say if you're drinking lots of water now, your body will cleanse itself out. So
and not twice a day.
I was on your mouth at least twice. And if you're doing less than, then say you are dehydrated or you're not drinking enough fluids.
For example,
Dr. Abner, okay, what is the average that?
Well, this is what I was gonna say. So, for example, I know, sir, for me, and I'm particularly bad at this, and I always say, sir, don't do what I do what I say, because, for example, me say I'm very particular with public toilets, and anyone who knows me knows this. I'm the type of person, to me, Johnson once a day, because Johnson the whole day. And it's not a good thing, because even and that's why sometimes I even avoid drinking water, because especially when I'm doing my 12-hour shift, I can go my whole 12 hours without drinking a single water or without passing urine, because hospital toilets, so the end and it's that type of thing. So I guess the advice here, and it's especially, and I think a lot of females are like them, Bema, the only problem, they just hover over the thing and then they do their business. But for us, you need to sit on it, you need to make sure it's clean and stuff. So a lot of women, and I find that a lot of women I've spoken to, in the younger age, I know the older the women gets, it's harder for them to hold on to their pee because of a childbirth and all those things. You generally go more when you're older. But for younger ladies, we tend to keep it a lot longer. So I think that advice is very good in a way. Say, yeah, actually, you need to pee at least twice a day, at the very minimum. for someone like
I was thinking doctors have got their own private somewhere that they do their business.
We do, but that doesn't mean it's clean because other doctors are, you're still sharing.
Yeah, I've heard that. Mm-hmm.
Yeah, so I often sometimes when I go to places, I try and go find one. So the bit of the place in the hospital that they say is haunted, so nobody goes there. That's why you go and find my washroom. If I really need to go, I will literally walk into a haunted house just to use the toilet, just because I know nobody has used it. But yeah, so anyway, I guess that's where the advice is coming from. In terms of the fizzy drink, you're right, it does cause headaches, but we also need to understand that things that work for some people don't work for other people. So I always say this, like when she said about the fizzy drinks, I was like, for me, I'm the same. I think fizzy drinks actually gives me headaches, and I've stopped drinking fizzy drinks because of, fizzy drinks gives me headaches. So I've actually stopped drinking fizzy drinks because of that. But if someone is saying that fizzy drinks helps their headaches, I mean, like I said before, medically, there's no medical proof, but that's just like even home remedies. Some people will say, ginger helps you not to cough, and that's true for me, but it doesn't work for everybody. So, some of these home remedies, you just have to try it and see if it works for you. It doesn't work for you. So for me to know, but it could work for someone.
Yeah, great.
So sorry. And on the other, we use the washroom twice a day. Again, it could be, so Felicia was quite right when she talked about constipation, because constipation is another cause that can really cause headaches. So maybe he means move your bowels twice a day, but I think even once a day is enough. But if you're able to go twice, well, good for you, I guess.
Okay, thank you, Dr. Akos. Nancy has also replied. So she no longer experiences any headaches or vomiting, but still hasn't regained appetite. It's trying to eat, but not really enjoying the food much.
Yeah. The appetite in itself, that could be due to anything. Perhaps it was triggered by the vomiting and the headaches, and now your body's just gotten used to not eating as much as it used to. So your body maybe just needs to learn or get back into the routine, because a lot of the time, if you even with fasting, a lot of people who tend to fast and they fast for 2 weeks, 3 weeks, even 4 weeks, they will find out when they come off the fasting, their body is used to them not having so much food, that your body gets used to a pattern. So if you were vomiting, I think you said up for almost 2 weeks or even longer than that, maybe your body just needs some time to get used to. So far as you're not having the headaches and you're not having the vomiting anymore, I will say there's nothing to be worried about. The only time I would say be worried about losing appetite is, are you losing weight as well? But even with that, it depends on how much weight you're losing. So obviously, the less you're eating, it makes sense that you'll be losing weight. But if you tell me that, oh, doctor, I was 70 kg and in 2 weeks' time I'm now 60 kg, then I'm worried about that, because that's too much weight loss within that time. So from what you're telling me right now, I would say there's no need to be concerned. But as I say, if you were to come to me as a doctor, I will ask you a lot more questions. And then from what you tell me, I can say, okay, be worried or don't be worried. But just from the small things you've said to me right now, I don't think you need to be concerned about the headaches or the vomiting or the loss of appetite. But just keep an eye on it, and hopefully you should get back to where you were before.
Oh, thank you, Dr. Akos, as ever. And now move on to Wellington's submission. So, I keep having headaches from time to time. However, the pain is right at the back of my head, close to where the bottom of my ear is. I normally sleep it off and it goes away. This happens at least twice a month. Is there anything I should be worried? Then it goes for a long time, say weeks before it returns. Is this something I should be worried about?
Just from telling me that, my answer would be no. And I'll tell you why my answer is no. But as I say, in a typical setting, I need to ask you a lot more questions to be able to identify if you have any red flags or you don't have any red flags. But from what you're telling me, I'm assuming there are no other symptoms and that it's just a headache at the back of your head. And if this is the case and it's coming and going, but it can go for a long time and it can come back for a long time, what that says to me is that it's not a chronic or persistent headache. So I'm not worried about that. It is a headache triggered by something, because it comes once or twice a month. So there's something you're doing within the month that's triggering the headache. Now, that could be that at the end of every month you're having deadlines, or it could be, I don't know if you work in finance, Abana always tells me that around April they have auditing or whatever. So if you're somebody who gets headache, that means if you come to me, you tell me, doctor, every April I have headache, and I ask you, what do you do for work? And you tell me your finance, I'll say it's because of auditing, right? So when you're seeing at least twice a month, it seems like there's a trigger, and it seems like whenever that trigger is gone, the headache is then gone, and then the headache is gone for a very long time, and then it comes back again when there's a trigger. So a headache diary. But from what you're telling me, it doesn't seem like it's anything, because if it was something to be worried about, it wouldn't just be once every two, it would be persistent. If you see what I mean, with the red flag symptoms I was talking, it will be persistent. There'll probably be other symptoms as well, maybe some fever, maybe some vomiting, there'll be other things in there. But if it's just a headache, once or twice a month, comes and it goes, it seems like an innocent headache to me. I wouldn't be too worried about
that. Thank you, Dr. Akos. Just to correct you, because if there are some financial people here, they'll be saying, Abina doesn't know anything. Please, that's not what I told her. I said that April is a difficult time for finance people, as we are ending a year, ending the financial year, beginning the financial year, and ending the financial quarter. Thank you.
Tell what I said.
The auditing is very different. It happens more.
Sorry.
Anyway, on to the next. This is not financial. Sure, but from Susan, hi Dr. Akos, can anemia also cause headaches?
Absolutely. So even before I was a doctor, my mom used to say this one thing to me. She used to be like, the beginning of every disease is headache. That's what my mom used to say. And she said, so because I remember when I was young, like I said, I've always had these sort of headaches, and whenever I start have a headache, my mom would say every disease in the body, it starts with a headache. So if you go to your doctor and say you have headache, you've not said anything, because it could be your heart, it could be your leg, it could be anything, but it all starts with a headache. As much as that is not true, and that's her layman understanding of how it happens, but in a way it is kind of true, because every condition or every disease can present as a headache, or some of the presenting symptoms can be a headache. So yes, anemia can cause headache. So I guess if the question you're asking is if you have headache, should you be worried about your blood levels and things like that? Perhaps, especially if you know that you're anemic, or you know that you've been anemic in the past, and you start to get some persistent headaches or some ongoing headaches, it's worth getting your blood levels checked, because it could be that you've got anemia as well. So yeah, that's definitely, simple answer to that is yes, basically.
Smashing. And one from, sorry, did anyone trying to speak?
Me. Yeah, Dr. Akos, she did answer my question. Yeah, I used to have them when I didn't know that I was anemic, but when I went through finding out, because that just came by the way, and I found out, and I pursued it, and I had a test, and they confirmed I was anemic. And after that treatment and process, I don't really have those bad headaches anymore. Yeah, so I think it was kind of related, because they claim the way the blood, someone says, the way the blood flows and everything was not flowing properly when I used to be anemic. So I think that was where they used to have. Yeah.
I mean, at the very serious end of anemia, and I guess this will not be true for all anemia that causes headache, but if you think of what anemia is, anemia just means you've got less red blood cells. And if you think about the role of the red blood cells in the body, it's to carry oxygen to your organs. So the less red blood cells you have, that just means that you're getting less oxygen to your organs. And if you think about the brain relies mainly on oxygen and glucose. So if you've got less red blood cells, less blood flow to your brain, less oxygen to your brain, it's almost like you're depriving your brain of the nutrients it needs to stay alive. In very severe cases of anemia, obviously this can cause very serious and severe headaches. But as you say, some people with anemia will have no symptoms at all. Some people will get a bit tired, a bit breathless. Some people will just get headaches. So it really depends. Everybody's different. But especially if you're a female and you're a menstruating female and you get consistent headaches, persistent headaches, and there's no cause for it, then it's worth getting your blood checked, because it could be that you're anemic. And a lot of menstruating females would be anemic at some point in their life, if not a lot of because we lose blood and we don't, and this generation in itself, we don't tend to eat very well. So we're losing blood every month, but we're not really eating good food, or we're eating this crisps, Coke, Fanta, so we're not really getting enough nutrients. So a lot of females, menstruating females, unfortunately, will be anemic, and it's very common.
Fast foods.
Yeah, just very bad foods. Fast foods. I mean, if you think about you're not really getting any nutrients from it. And the thing is, I always say to people, even if you're eating these types of foods, just make sure that you're having supplements. So make sure you're having iron supplements, your vitamin C, vitamin D. Everybody on this platform needs to have vitamin D, no matter how healthy you are. Vitamin D deficiency is huge, and maybe I need to do a session on this, especially in Black people, because if you think about our skin is designed to block out sunlight, so we actually don't absorb enough vitamin D. So if a white person is to walk 5 minutes in the sun, they could probably get enough vitamin D for the rest of the day. A Black person needs to at least spend 30 minutes to an hour in the sun. Which sun? So here in the UK, you made me laugh. So here in the UK, if you have a dark skin tone, you need to be on vitamin D tablets, regardless of how much time you spend in the sun. I don't care whether you're construction work or whatever. You need.
Dr. Don't insult my country. There's sunlight over here.
Sure. So yeah. So please take your vitamin D tablets. Very important.
Dr. Akos, please, can I just quickly say something about vitamin D? Please. Yeah. I know you are but it's a very serious thing. We don't take it serious. And it's caused a lot of in my life. 2011, I was complaining of everything. Name it. My joints, my knee, everywhere. And then they did all the tests and everything. They couldn't find out. I lost my hair in the middle. I'm very hairy. But in the middle, everything it was as if I was going bald. So thank God my ESR was raised. So they started doing all the tests and other things. And then I met one GP, Ngozi. She's a Nigerian. And then she said, have they done your vitamin D? I said, well, I don't know what they've done, And then they said, okay, let's do it and see. And it was, I was at home. I did the bloods in the morning. 8 o'clock, the doctor GP called me and said to me that, listen, you need to go to the hospital for an IV because it was undetected. There was nothing. There was not, I was just deficient. And I told her, I said, listen, when you work in the hospital, you don't want to be a patient in the hospital. So I just said, okay, listen, in the morning, I would just come. It was 2 options, either an IV or take 12,000 units for is it 2 weeks? Yeah, 2 weeks. And then I went on 2,000 units for 6 weeks. And I can tell you, when I read into the deficiency of vitamin D, it can cause cancer. I did read something about that. So vitamin D is very, 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 I used to take it during the winter month. I take it throughout the year because I read somewhere that when you're on blood pressure, I'm just on a maintenance dose, 5 milligrams of amlodipine. But the point is, when you are on blood pressure medication, so I wanted to say beta, so I had to change it. Blood pressure, so you have to take vitamin D to strengthen the heart muscles. Because all this hypertensive medication, it weakens the heart muscles. Whilst you are taking the vitamin D, it helps strengthen the heart muscles. And again, I've read somewhere I take vitamin D with K2 because without K2, the vitamin D
I think you mentioned this before, and I said I wasn't sure about the K2.
Yeah. Oh, please go and read and tell me if I'm I have done a lot of research into. I've read a lot about vitamin D because without the K2, but you take it. But you know, K2 helps the vitamin D to, should I say, circulate in the body. Person can't wait to be a case be a name.
Yeah.
And every person be seeing a Dr. Kuz. Thank you.
No
That's my
problem.
little
No, thank you so
contribution.
much. Yeah, no, thank you. I think that's important. And actually, since you've mentioned it, I think I might actually just do one based on, like, I might do a vitamin series. So I'll do like vitamins we should take, and maybe I'll do, like you said, I'm not going to do it all at once because I might rush through it. But maybe I'll do vitamin D today, then I'll do vitamin C tomorrow, then I'll do I'll do the vitamin series. I think that'll be, maybe I'll pick a month and I'll do that. I think it'll be very important. But yeah, when I saw you touching the middle of your head and doing all sorts, looking for vitamin D,
it's very interesting. Yeah, no, because that vitamin D thing, it's very, I mean, I know about the fact that we need to boost our vitamin D as, people of color. People of
no
color.
jokes aside, it's very important. Even in Ghana, I know
hair
that
loss and what all those
now, giving the advice to people in Ghana, because a lot of people who live in Ghana feel that they are directly exposed to the sun, so they don't need to. But even then, because our skin is designed to withhold, to just withhold the extremities of the sun, even being exposed to sun in Ghana is still not enough for us. So we really just need to take those supplements. Yeah, it's very important.
And also, correct me if I'm wrong, but I think that even for the people who live in Ghana, I think there are certain hours or certain periods of the day that you shouldn't be in the sun because of radiation or whatever the case might be. So it's not just about sunshine, let's go inside. So I think we have to educate ourselves about all these things. We've got hand raised by Comfort, and doctor, I think I'm getting a cluster headache. I'm not lying. My eyes are hurting.
I've passed it on to you, so because mine's getting better now, so maybe it's just transfer.
But Comfort has got her hands up, so shall we take Comfort?
Hello, Dr. Kuz and Abena.
Hi.
Hello.
Good evening.
Good evening.
Yeah, so my question is, in the past, GPs used to routinely check vitamin D levels of patients, but for some reason they've stopped. They don't even when you request, they said there's some, so they are not doing it. So you're saying it's because of money. The other thing is, my second question is on sunscreen. When we go to Ghana or visit hot countries, is it advisable for us to have sunscreen? Because the last time I went to Ghana, it was so hot outside that I was standing in the sun. I felt like I was standing near an oven. Honestly, I was bewildered because it wasn't that hot, many years ago. So these are my two.
So, I think it's very important. And again, I think maybe, I will add sunscreen to vitamin D talk because it's a very important point you've made. And we've always been of the notion, even when we were younger, I remember my sister and I went to Switzerland, we went to ski in the Alps. And even though it's obviously very cold, but you're nearer to the sun. So there's a lot of sort of sun rays coming down. And, they were like, oh, wear sunscreen. And Abena and I were like, have you seen our skin? Like, why do we need to wear sunscreen? But becoming, obviously, the older we got and the more sort of reading we did, and especially doing medicine as well, I find that it's not just about the ability of your skin to burn to the sun rays. So if it was just the fact that we're going to get a suntan or something, sunscreen is not important. But within the sun, you have UV light, and within that UV light is able to penetrate your skin and get under your skin and react with the skin cells. And when they do that, they're able to convert or change some of the genetic makeup of your skin, which then causes you to have a higher chance of developing skin cancer. So exposure to sunlight can actually cause skin cancer. And the reason we use sunscreen is to block the skin from the sun from reacting with our skin cells. So that's why is advisable. Now, on that same note, when I said you can get vitamin D from the sun, if you put sunscreen on and you go into it, you're not going to get the vitamin D because you're actually blocking the light. So it's almost like a catch-22 here, because yes, you get, when being in direct sunlight, you get these effects of the vitamin D, but at the same time, you're exposing your skin to these levels of UV radiation, which can then cause skin cancer. So things like melanoma, for one. There's a particular one which is actinic keratosis. Now that one is precancerous. Sometimes it doesn't turn into cancer. Sometimes it just stays like a mole. But all these, but sometimes so it's like you get a mole on your skin and the skin doesn't have any. It's not cancerous, but then sometimes that mole then being exposed to sunlight can then convert and become cancerous. So sunlight actually does have very damaging effects towards the skin, and that's why we advise to wear sunscreen. And that's why I say, just wear your sunscreen and take your vitamin D tablets. You know, that is literally it. So so sunscreen is not just there to protect us from burning, or it's actually there to protect us from cancer. That's the purpose of it.
Yeah, the circles. I've read that, or been informed that if you really want to benefit from the sun, is between 10 and 11 a.m. Is that correct? So if after 10 and after 11 a.m. you don't really, you will not benefit from the sun, and therefore maybe that's when you really need your sunscreen.
Yeah, absolutely. And this is what I was saying in terms of the times to go. My mother usually says, you don't go into the sun when it's got, you go almost when it's a reflection, when it's like you're getting sun rays, but you're not getting the actual heat. Because, that's, it's an important point to make. Yeah. But no, thanks for that question. I think it's an important question. I think even Comfort wrote a note on she asked about caffeine as well in the chat. I think
she spoke about maybe people drinking caffeine. Maybe that's withdrawal. Why people take the Coke?
Okay, fair.
Drink the Coke. There is a question in there that it's a submission from Kofi as well, which is to avoid using earbuds for too long due to exposure to sound waves direct to our eardrums, and also the electromagnetic waves from the Bluetooth, which could potentially cause I was about to say cancer, but no, headaches is what we're talking about today. Headaches. Yeah.
Like Akabana, she's going deaf because she's been listening to too much music.
Oh God. I wouldn't say I'm going deaf, but I have ruined my ears, I think. Because I listen to too much music, so it's very true.
Just wait till you start a family, whether you have time to put things in your ear to listen to.
To be honest, I've even stopped now because after I was diagnosed with, what is it called? Tinnitus, or whatever it's called?
Tinnitus.
Which is unreversible. So like at my young age, I have ruined my ears. Don't be like me. So try and not listen to use the earbuds or whatever, or listen to music too loud. Not great. And most certainly using screens for too long, and also using screens in the dark, which is something that a lot of us young people do, because you're like very relaxed in your room with doom lights, and then just before you go off to bed, you're like, bright screen, dark room. That's not great. So
that not only does that cause it ruins your eyes, but it can also give you a headache. So that's it's something to make a note of. I think that was our last question, right?
Yeah, I've
just got a text here. Somebody's asking me, does constipation run in the family? It can do. It's not, some of these things a lot of traits tend to run in the family. We don't tend to pay attention to them, but it's not that the constipation in itself will run in the family, but it's the cause of the constipation. So, for example, some families just have a slower digestive rate, which means the food stays longer in their gut, which basically leads to constipation. So, if you've got sort of a slow gut motility, and that can run in families, because obviously that's genetic, so that can cause constipation. So that's it's not the actual that the constipation is is running in the family, is the cause of the constipation that runs in the family, but the effect is constipation. So
Excellent. I think we've come to the end of our questioning, and just 20 minutes over time, not too much, not too bad.
Let's try to be on time.
Not too bad.
I got my question back on. So Dr. Abuna said Dr. Kositi and I'm back on so off duty.
It's okay. It's okay.
Okay. Satin. What is that medication?
Satin.
I think she means statin.
Oh yes.
Okay. Thank you, Dr. Felicia.
Anti-cholesterols. So statin medications are medications that lower the cholesterol in your bloodstream. They do that in a number of ways. Is there a particular question you wanted to ask about statins?
No, if a doctor is going to give it to somebody and they think, well, not a doctor per se, but apparently they say their pharmacists call them. Okay, some GPs have got pharmacists now in the GP surgery. Yeah. So call them to say, according to what they're reading, their history, they think they will benefit from putting them on that. And they are not too sure. So I said, well, I've got my Wednesday and I'll find out for you. But trust me, I couldn't even remember what the name was.
Atorvastatin?
All right.
I'm asking. There are several ones. The atorvastatin is the most common one. The simvastatin and other ones as well. So
just say the statin.
Yeah.
Okay. Yeah, there's some lifestyle changes. Be able to me, I bet to me and lower cholesterol. No.
Apparently, was what new BB say, because remember I asked all the questions. Okay, well, he said was what be, but because pharmacists they say on other medications our one, and they were expecting a lower. It's not very high, but I think 0.1 or something above the normal range.
Can I ask if the person has got a cardiac condition?
No.
No. Okay. Doctor, any major man patrol.
Hey, doctor, where do you what on them?
I just I'm a Ghana to be our job.
Okay.
Have you got your sunscreen? It's very hot.
I was told just yesterday, yeah, so I haven't. When I get to the airport, I'll buy some.
And also, I think the very hot anti-comfort can. It will be anti-malaria tablet na fun. Say it makes you feel extra hot. If I'm lying, doctor, correct me.
I'm not sure about this, but I'll have to get back to you. I don't know.
Okay.
Yeah.
Because
is it the weekly one or the daily one?
The daily one.
But I'm not sure about that, so I'll have to get back.
Is it Malof or yeah?
No, the doxycycline.
Doxycycline, yeah,
anti-malarial, absolutely. So anti-malarial antibiotic. I love it.
Yeah. Okay, so let me for the purpose of time, let me answer because I realize there's more questions popping up in the chat. So answer Liz's question in terms of the statin. So I'm a bit torn between this one because I don't. I think it's a personal decision is what I'm going to say. The reason I say this is Felicia is absolutely right. With the cholesterol, you can choose lifestyle changes. So making sure you're eating less fat, exercise, and that sort of thing. Some people have really high cholesterol, and in that case, they may need the help of a statin to bring it down. The reason doctors don't tend to like statins very much is because they can cause quite a few side effects as well, especially when it comes to muscles. They can be quite nasty drugs. You get really bad muscle pain with them, and that's why we always advise you to take statins at night, because when you take them at night, you tend to sleep, so you don't tend to feel a lot of the side effects. If you take them during the daytime, they're really horrible drugs. So yeah, a lot of us try to avoid it as much as we can. There is evidence to say that sometimes they calculate something called your Q-risk score, and that's basically the likelihood that you will develop a heart condition in the next 10 years' time. If that score is high, then they advise you to start taking statins, because essentially
Dr. Abner, what's so funny? Who is writing you notes?
What happened?
No,
I think my dad just popped up behind. Yeah, so if it's if your Q-risk score is high, then it's the likelihood that you're going to develop a heart disease in the next 10 years' time. So they advise you to take statins to avoid you getting heart disease in 10 years' time. However, like I say, this is where it gets a bit dicey for us doctors, because we say, okay, it's difficult. So I think inevitably at the end of the day, it's a choice that you have to make. It'll be difficult for me to tell you yes or no on this question, unfortunately.
Yeah, there's a family member of mine whose cholesterol level has always been around 5.3, 5.4, and she was always being advised on lifestyle changes until she was diagnosed with a heart condition. Then she had no choice; she had to go on a statin.
But you see, someone like her, they would have said, I think the new evidence is that if she had been started on a statin earlier, then she would have not developed the heart condition. Do you see what I mean? So because she's got such high cholesterol, if she had taken the statin earlier, it might have prevented her from getting the heart condition. But now that she's got the heart condition, she has to take it regardless. And that is why some people say, as soon as we say that you have a risk of developing a heart condition, we're just going to start you on the statin anyway. And this is why I say that this is the decision that you have to kind of talk about with your doctor and come to a decision. I can't help you make that decision because I don't have enough information, unfortunately.
Dr. Coast, just a quick one of my neighbors around me told me, I think late last year, said they want him to take atorvastatin. And he said when he asked or he read, a man called Enya light off. He doesn't want to take it. And I have been trying to advise him to say, listen, you need to weigh the cost. If you can just do a lifestyle change, and then the things that you never obey in the race, I'm trying to create advise him as to but also ultimately so it's quite difficult when you are advising the men.
It's one of the side effects, yes, but at the same time, it's not a common side effect. So it's one of, I wouldn't be too worried about that. If you just tell him, I wouldn't be too, it's not something that's very common.
I have actually said a lot, and he's telling me that at my age, I'm not even 60. You want me to have a light off. And I don't know. I have said everything. I wish I will invite him on
invite him. Tell him Dr. Coast wants to invite him.
So that maybe you can educate, because he said, in that light of BNA.
Okay. So, are we going to take the questions, or
I'll take them. I had a question later until Liz the Obisano some tree word like I've forgotten. I can't remember. I will see it again. I'll ask. So I'll start from the bottom.
Me can't say nipa kura no ya besiri wanana.
Besiri was the what Patrol to me explain.
Oba. Let's say Oba penny man penny.
You see, I knew you would be an age thing. I just wanted to know which one.
Until is Abesiwa. Until is Abesiwa.
An elder person. An elder person.
Thank you very much. Thank you very much. So, okay, let's go through. We've got hand raised and two. So let's try and run through this as quickly as possible. So I'll start with Esther. So my son's optician once said using phones in the dark does not affect the eye. I strongly disagreed, but he was adamant that it didn't. And Kofi has also given a submission that the doctor is not doing your son any good. The eye will adjust to the blue light from phones, and he will begin to experience dryness or watery, itching, blurry eyes.
For the purposes of time, I'm just going to answer the questions. Is that okay?
I actually wanted to use my experience to even speak and say I'm not medical. I'm not medical, but I remember when in my teenage years, my mom Once I know about the switch off the light, thinking, say, I will then stop using my phone. And I used to be on my phone for ages in the dark. And there was a time I woke up in the dark. I wasn't blind, but I woke up in the dark and I couldn't see in the dark. I was literally getting partially blind in the dark. And that was that was just what stopped me from doing that and trying to restore my eyes. So I'm not medical, but I don't think I don't know.
It also interferes with your sleep.
So yeah. Doctor, take it up from there.
So, I mean, from a medical point of view, and I always say this, I don't like it when like they give you half of the story. So technically, it actually doesn't ruin your eyes technically. Okay. And what I mean by that is in the short term, it can give you some discomfort but there's actually no evidence to say that looking at your phone or looking at something bright in the dark ruins your eyes on a long-term basis. However, here's the catch-22. So we know that the blue light from screen does ruin your eyes. So it's not the looking at the phone at night which is causing your eyes to be ruined. It's the blue light emitted from the screen. So like, for example, when you're looking at your laptop or you're watching TV, why do they say don't watch TV? So I guess in the way, whether you use the phone at night or you use it during the daytime, there's still going to be blue lights emitted from the phone. And I guess that's why the medical professionals say looking at the phone at night does not cause. But I think that we shouldn't do that, because if we do that, we're not being honest to people. And another thing we say is, even though there are technically no long-term effects on the eye, but there are short-term effects, like you said, short-term effects on the eye. And if somebody's using the phone throughout the night for a very long time, those short-term effects then become long-term short-term effects, if that makes sense. So again, I always say this is some of the things that we shouldn't say to people if we're not going to explain to them that this is what I mean by it has no effects on your eye. Now, and another thing I say is, if it feels wrong, then it is wrong. See, the thing with medicine is a lot of the evidence that we have right now is evidence that we have for 2025. In 2032, new evidence can come and say, actually, that phone that we said does not ruin your eyes, we found out that is the number one cause for blindness in youth. Yeah. So do you know what I mean? So sometimes you just have to use a bit of common sense here, or like a bit of brain here. When I say that, for example, if you know that even you, when you're looking at your phone at night and you're in the dark, your eyes start to hurt. So somebody does not have to come and tell you that this is bad for your eyes. You see what I mean? Because right now, the evidence that we have is showing us that there's no difference. But you yourself should know that actually, this is not even good for my eyes, because it makes my eyes uncomfortable. So you don't have to wait for somebody to come and tell you before you know, okay, let me stop doing this. So I guess that is what I will, from Esther, this is what I will say. Sometimes opticians and doctors will tell you things, but that's because we have to tell you what the evidence says. But trust me, if that same guy is advising his son, he will not give this advice to his son. Trust me. It's true.
That is true. But yeah, so on to the next, and then we go to JB to close off. So from Fred, I have moderate TBI I had moderate TBI. Could you?
Is that traumatic brain injury? Please.
Could you explain TBI to me later? About 5 years ago, I still have headache once or twice a week. Should I be worried?
If it's traumatic brain injury, then I will say that I will be a bit more cautious. If you're getting it that frequently, then I would just go and get it investigated. I would tell your GP, because your GP would have your medical history and your GP will go through the red flags. If it's something that your GP thinks is normal and is in keeping with the type of injury you had, then they probably wouldn't do anything else. But if they feel like actually, because of your history, they probably just need to get a scan just to make sure there's nothing else going on. So, I mean, if you were my patient, that's what I would do. But as I say, it depends on the type of headache you're getting and the kind of symptoms that you're having alongside them. So I think it's definitely worth getting investigated just because of your history of a TBI.
Fab. And we'll close off with JB.
Good evening, Dr. Coles.
Good evening.
Happy New Year too.
Happy New Year too.
I just want to ask a question about headache again, even though you said it over and over. It's like sometimes you have this kind of headache that you can't even explain it to your GP. You can't explain whether it's a pounding one, but it's like you're having some strong headache that when you move yourself or you try to walk even, the pain is so severe, and I don't know how I will explain it. So if you go to your GP, how do you tell your GP? How can they understand how you are feeling? Yeah.
So, headache diary. The reason I say this is because even if you're not able to explain exactly what's happening, you can, like you've said to me, so just now, I can tell how severe the headache is. Because if you're getting a headache and you're not able to walk, you're not able to move, you're not able to, how long is that headache lasting for? Is it lasting 5 minutes? Is it lasting for an hour? Is it stopping you from doing your daily activities? If you write all this down and you tell the GP is able to, you don't need to explain exactly, because we will ask you things like, is it a sharp headache? Is it a dull ache? Is it moving anywhere? Is it affecting your eyes? We'll ask you all those questions. But if you've got the headache diary and you're telling me, okay, when it comes at this time of the day, it lasts for this long, nothing makes it better, or so and so makes it better. When I take paracetamol, the headache goes from a 10 out of 10 to maybe an 8 out of 10. If you've got all of that information for your GP, certainly the GP can work a bit better. Just from what you've said to me, it sounds like a pretty serious headache, but it could be a migraine headache, because we know migraines can cause some of the. So migraine headaches can cause debilitating life, they can be so debilitating that they actually affect your quality of life. So people who tend to get migraines will literally stay at home for 2 or 3 days so far as they've got the migraines, and it sounds like the kind of headache like they'll have to be in a dark room, so they can't go to work, they can't do anything, and that's like a migraine is that type of headache. But the only reason we'll know that it's a migraine is if we've been able to take a proper history from you and we've been able to solicit those things. I don't know if that makes sense, JP. So, still go to your GP and talk about the headache. But if you have a diary, it's a little bit more clear to us and we understand it a little bit more, because we can tell a pattern from the diary that you've given us and we can say, okay, I can see what's going on. As opposed to what you're telling me right now, if you came to me today and you said, I have a headache so bad that I cannot walk, I would probably be thinking, is this a thunderclap headache? Is it a subarachnoid hemorrhage? But it doesn't sound like it is, because you've had it several times and it's not just a one occasion. It sounds like you've been having it for some time now. So it doesn't sound like it's, so it just, we just need a bit more history, basically.
Okay, because it's like when I talk to my son, he's a doctor. He said, Mommy, you are not telling me anything. Tell me, and men don't have patience to listen.
It's what I'm not even gonna I think when this is why doctors don't look after their family members. I'm exactly the same with my parents. Like my mom or my dad will tell me my dad has always got a headache. Like he's always got a headache, and I'm like, he'll say, of course I have a headache. I'm like, hey, another one, and I just move on. Like I'm not ready to listen because it's not a good thing, I know. But I think if it's because you guys are our parents and we just feel like you just want to use us because you pay for us.
Imagine.
Thank you very much.
No problem at all. So yeah, just keep a headache diary, see your GP. I'm sure they'll be able to help you.
Okay. Dr. Akos, sorry, I can't raise my hand. I tried. And
okay.
I'm the one with the teary eyes last week. Yeah. I went, and because I use computer all day and I have one document may have 50-page document, I was told that I'm glued to the computer, the monitor too much. That's why I'm getting a sort of dry eyes, being watery. So I was warned to take breaks from the computer. We were talking about computer not giving you, or monitors not giving you headache and all that. Yeah. When I explained, he said, your headaches, your watery eyes is from the monitor. And it's just the beginning. So if you don't take the breaks, you're going to suffer in the future. So the sooner you start, the better. So that's what I was told. So I think something that we have to be aware of.
Yeah, Ma'am Kunedu, were you told by your boss or the doctor?
The doctor.
I think, yeah. Because she came last week. So I'm actually happy you came back, because she came last week about teary.
Yeah, that's true. Yeah.
See her optician. Yeah. So I'm glad you did. And obviously, again, keep us up to date if how things go. But I think it's a good start. So stay away from, and blue light glasses, I think, are really good. So yeah,
Yeah, I've invested in one.
Yeah. So, all right, guys, I think we need to end now because it's almost 2 hours.
And thank you,
Dr. Akos. With all your headache, you've managed to take us through. Thank you.
Well, it's always my pleasure.
Well done. But me na wo me buy and na brofo na san resume for them. To hey, medjuma na me ye kwa.
Oh, that we at least to be kwada. We will alternate. Dr. Kofi, we love to hear it. You have been enlightened today, and that's what we are here for, and that's what we aim to do, is to enlighten ourselves and each other. And see, it's lovely to hear. We encourage you to keep coming. Dr. Akos, your contact is one up there. There it is. She has dropped TikTok, Instagram, email. You can always email us.
Abna, look, Kofi has summarized everything there. Have you read Kofi's comments?
That's right. I read through. That's what I read through it, which is headache diary, and not add symptoms to whatever you experience that's not related to it. That's what I was saying. We love to hear it. The fact that he's been enlightened, and the fact that hoping that everyone here has been enlightened. Definitely, I have been enlightened. And I always say I love these shows because Dr. Kosi can have patience in my eyes. So at least here we get to really
you get to ask your question
ask our question.
I don't have patience for them at all.
Bring your fiancé. Bring your fiancé next week. Bring him.
Who is this?
I want to shout out to I can see Kofi Esimpi on the phone. I think he's been so so patient, but he's been there consistently. So thank you for joining the show. And I think Esther sister Esther. I don't think it is. I'm trying to clock. I think it is, but if not, anyway, thank you for being here. And I think John Abwe as well.
Yes.
Yeah. Hello, sister. Thank you for joining.
Sister can pregnancy cause headache? I'm not pregnant, but I need to ask that.
Pregnancy causes everything. Pregnancy absolutely causes everything, and yes, it can cause headache. Again, from the hormonal side, because if you think about pregnancy, all your hormones are just thrown up into the air and told to do whatever they want. So they can cause headache.
That's a lovely way of summarizing what pregnancy is. Almost thrown up into the air.
It literally.
Dr. Abner.
Yes.
And my boss. Okay. Yeah.
Okay. Hey, Auntie Liz.
Yeah, Pong.
All right, and John Abwe, as I was saying, thank you for. I think the first time you came was last week, but thank you for joining again and being there. And thank you everybody for staying for so long. Oh my God, we had much more earlier, but I think some people have dropped off just because we've gone on for too long. But thank you to everybody who's here. Gifty Queno, Suzanne, Auntie Naomi, all of you. Thank you so much for being here.
Yeah, and thank you to Tap Send as per usual. Please download, share. A friend say click. The only a friend is saying money sending. Your friend is saying that you should be using. Nobody else matters. But Tap Send. And really true from experience as well. I have to say they have the best rates and everything else. And
so crowd, you're asking who I could make a donation more on their more.
It's they're unbeatable. You can't do anything.
No one can beat them now.
Tomorrow is time with Tap. I think I might be doing stroke tomorrow on time with Tap. I think. I'm not sure. So if you missed stroke last week, I think it's tomorrow. I can't remember, but yeah, come back. And then Friday we've got lawyer. Ask the lawyer.
Yeah, ask the lawyer. So any of your, if it's immigration, law needs, this will be the place to be. And of course, join the OT Media Friends and Community. You can get all the updates. And ask your questions. We put our details in there. Sorry, I'm talking a bit fast. When I said we should be slow, we put a lot of our details in there. If you have any specific contact, specific doctor, specific topic you want us to address, or even questions after the show that you want us to answer, obviously I won't answer them. I'm not medic. I direct them to the right places. Please drop them into any of that. You can contact us via TikTok, email, Instagram. Yes, so, and I think that will be it. So have a lovely evening, everybody, and see you next week. See you next week.
Thank you very much.
Happy said. Oh, that was you're from Calabos, the only boss. With oneness, baby, I will be everywhere a day and everywhere they go. Tap Send got me covered. If you need to send money or transfer money from Europe, from Canada, from USA, from UK, any part in Europe, you can send it through TapTapSend, and guess what? Oceania, they will receive it right here in Ghana and many countries across Africa. So what are you waiting for? Download TapTapSend now on Google Play Store or App Store. When you download, it's so easy to use. Tell your families, tell your loved ones to download TapTapSend. Okay? But also, when I receive my money, I tell them I would channel, like my view, hey, you crazy.
Download TapTapSend now on Google Play and App Store. TapTapSend, it's secure, convenient, easy, and fast.